Hello, everyone. I'm Marie Castellucci, Deputy Editor of the Content Studio at Modern Healthcare, and it's my pleasure to be moderating this session, Leveraging Data for Smarter Financial Decisions. In this session, we'll be discussing how healthcare organizations can use data to improve financial outcomes and optimize revenue cycle management, with a particular focus on the use of AI and automation. I'm thrilled to have an esteemed group of panelists here today to talk through this topic with us. Claire Agnew, Chief Financial Officer of ValueWise Health, based in Phoenix, Arizona, Megan Broom, Director of IMO Health, and Robert Flannery, Chief Financial Officer of UW Health, based in Madison, Wisconsin. Thank you all so much for being here today.
You're welcome.
Thank you.
So to set the stage, how are each of your organizations currently using data to improve finances? Claire, let's start with you.
All right, so we use data on a daily basis. Right now, in terms of with the potential federal legislative proposals for significant changes, these could affect healthcare reimbursement. So we're using our data to look at how that may affect us. We're a large safety net health system. Medicaid is our largest payer, so even the smallest changes could have a large impact on us. So right now we're going through the various different options and proposals that are there with as much knowledge as we can, using data to try to estimate what that impact will be. So then we can go ahead and prepare and make our next steps when that uncertainty is taken care of.
Yeah, that makes a lot of sense. Bob, how is your organization using data?
Yeah, I think that really kind of going off of what Claire had indicated, so much of what we do uses data to improve care and finances. I think using data in the care setting to order the right test, using the data on the back end to determine how we can leverage our buying power to lower the cost of that test, and then benchmarking data, how we can reach out to other organizations that appear to be doing things more efficiently or delivering higher quality than we are. So we've been using data for decades to drive improvement in quality of care and finances. With advancements in better data analytics, I think it's improving to have a really greater impact on patient care and organizational finances.
Yeah, Megan, I would love to hear from you how your organization's using data and then how you work with other organizations to use data for finances.
Thank you. Yes, as IMO Health is providing a lot of the data that is used inside of a healthcare's ecosystem, all the way from the point of care down through the secondary usage of data. What we've done is really tried to invest in those solutions to inspire as accurate data quality as possible. That is going to drive a lot of the reimbursements like Claire and Bob have referenced, but also allow for analytics that allow you to see where there are opportunities for improvements in the ecosystem to capture better data, to use the data in ways that can allow for better financial optimization, and just overall to give reports that will allow for CFOs like Claire and Bob to be able to benchmark themselves against other organizations. And with IMO's footprint being so comprehensive across the United States, we have the access to allow them to really see those insights that could be very powerful for them. So we're just looking to invest in our current solutions and also build new solutions that give better access to that data.
Yeah, and I think it's really helpful for our audience to hear examples. So can you each share a real world example from your organization where you're using data analytics meaningfully to help improve that financial performance? Let's start again with you, Claire.
One of the things that we did in a recent project, and we look all the time in terms of is in our trended referrals. And this comes in terms of from external providers coming into our specialists. So we look at this in terms of who is providing how many patients to which specialists. And we also look at the payer mix that they are referring to us. And one of the things that we identified was some that had material outliers. They were known in terms of what their usual payer mix is. We identified that it had materially varied from this, I will say. And so the first stop is a discussion in terms of with those external providers, because we saw this change. And actually, in terms of with these providers, we have memorandums of understandings or MOUs with them on the referrals. So we went through and made changes to that contract and gave them new language as well, because as much as it is, in terms of being able to have the discussions, we also can go ahead and put it into writing. And then that way there's an accountability to that as well. We don't want just one group of payers. We want it to reflect what their existing payer mix is as they refer patients to us.
Yeah, that's really interesting. Bob, anything else to add with this?
I think I would just, share, Maria, again, I think that we all are aware of the fact that the federal government had really required transparency information from providers and then eventually payers. And I think that it's really provided insight into payer rates with others that operate in the same markets that we do. And I think that analysis and analytics of that information allows you to go into negotiations with an understanding of where your organization sits compared to other healthcare providers. So it allows for dialogue, and it shows when you're at a disadvantage. It might show when you're at an advantage, right? So I feel like, it has provided, I think, the opportunity for more robust conversations with payers. And, it's really hard to disagree with information that's actually posted on websites in terms of that. So again, that would be an example that I would give in terms of, I think, how information was concerning in the beginning, but I think that many of us have kind of grown to appreciate that transparency.
Yeah, that's really interesting. Megan, how is IMO Health, working with organizations? Can you share a real world example with us?
Certainly. One that came to mind whenever you talked about, a real life example where we were able to make that, impact on the financial bottom line by using data is where we collaborated with customers, health systems in order to do analyses on their denial data. And so that we could really pinpoint the actual source of a lot of these denials and actually be able to track that then all the way back to where that was occurring in the workflow. And so by doing that through data analytics, we were able to provide a very targeted and tailored solution that has allowed hospitals to see about a 10 times annualized ROI based off of what the success they've seen after putting that into place. So that was where data analytics helped us inform the most effective solution.
And
Wow,
Maria,
that's great.
I was just going to say, Maria, I might jump in just as Megan, made that comment. I think that, the idea of it's getting harder and harder for providers, right, with all of the things that are thrown at providers from a payer perspective. And having that analytics, right, to really be able to go to our care teams and help them identify how diagnosis coding has an impact, how workflows are having an impact, et cetera. And it really is impactful, I think, in terms of having that information to really work with our teams to make sure that we can avoid those denials by actually doing it the way the payers want to on the front end. It changes daily, right? I say that in just a bit, but it seems like it changes frequently. So again, I think that analytics just really has improved our ability to make changes.
Yeah. That's really important too from the administrative burden side of it too, I imagine. So we wanted to talk a little bit about AI during this panel as well. So there's a lot of talk about AI and how it's going to transform healthcare. I want to talk about how it could maybe transform financial operations. So where are your organizations on this journey? How are your finance teams using AI and machine learning right now? Can you kind of talk about that? Let's start with you, Bob.
I would say, Maria, that we're certainly on what I would call the early end of the journey, right? Like it's a long journey, and I feel like, a lot of new things that are out there. So I would put us, kind of in that early stage. I think our EMR and billing system has a lot of machine learning and analytics as it relates to our revenue cycle function. We're using it more and more internally as we discuss things with our staff and providers. There are payer scorecards, there's denial reporting, et cetera. And so our revenue cycle is a critically important team, and we've been focused on using the systems and tools to help us be as efficient and insightful with payers and patients as we can be. So that being said, it is a daily challenge as payers are further along using AI to make it more difficult for providers to get paid without adding additional resources. But certainly, I think that's something that we're embracing here to really make sure that we're leveraging it where we can to really lower the cost of care.
Yeah. Claire, how is Valleywise Health using AI and automation right now?
So, as a safety net provider, we're not the early adopters, and but we've made some significant changes inside of our rev cycle. And as we look at that, for example, I'll give a couple of examples: predictive analytics for payment collection, whether it's from the patient or from insurance; automated coding, such as single visit coding; claim scrubbing, and some error detection tools. Things to help us in terms of with denials and appeals. We're early on inside of that side of it, payment posting, eligibility, all of these things put together along with some other changes that we've made. We have seen a change of 15 days in our days in AR. And this is just in the last, I'd say the last that 9 months. To be able to make that significant of a change, it is dramatic and without having to add significant costs. So it's that time to cash and being able to have that better cash flow for us.
Yeah, that's huge. Megan, talk about how IMO Health is using analytics and AI.
Yeah, absolutely. Internally we have our own utilizations, of AI in order to help, drive and customize our solutions. For example, like Bob talked about, all the payer specificity and variability is difficult to scale to if you don't embrace AI in order to do so. And we've been able to do that internally so that we can scale to the diversity of our customers' payer mixes. But on the other side of it, what I'm looking to do is really drive as much data quality in the health system as possible so that when they do make investments in AI and machine learning solutions, that those are fed with the cleanest data so that they can get the most accurate, cleanest result out of it. Because all of this is to make more actionable, better decisions based off of, the data that we have available to us. So that all kind of hinges on the accuracy of it. So the old garbage in, garbage out, thing that we deal with, that's where I'm really looking to inspire feeding these solutions with better data.
Megan, if I can add on to what Megan
Yeah.
is saying, one of the changes that we're also going through right now is a refuel in Epic, which is our EMR system. And this is going to allow us, if we're doing things, we're trying to bring it down to the foundation level. Because the more that we are like the other Epic facilities, then the more we can use comparative data inside of Epic. The more that we're special, it's not. So going back to that, it starts with good data. AI is not going to be good without it. And to be able to have that information, again, we could look like we're amazing, but again, our stuff may be counted differently. And then that's just garbage. It's just telling me I look good when I don't look good. So I want it to be right. And so
Yeah.
right now, that investment that we're making in that refuel is going to be able to allow us to have more tools, to be able to have more comparisons, to be able to have better data for everything to be built off of.
Yeah, that's really interesting. So I want to talk through this kind of conception about AI and its concerns on overtaking what humans do right now. So kind of how do you balance automation and human oversight in this financial decision making? Can I start with you, Megan?
Sure. Based off of where IMO is kind of at within the workflow, we're right there at the point of care. And so we're driving a lot of that documentation that's happening by providers. So a lot of our solutions are going to then thus be focused back at that provider. So it is at the forefront of my mind every day of that balance of what do I need to put in front of the provider and what can I take care of with automation and AI. And as we are evolving very quickly, that balance is changing quite literally every day as the technology evolves, how much we can shift to automation, but then how much always still has to have that provider oversight that is critical for the landscape that we're still in today, and still vetting and verifying and validating a lot of the insights that are given to us from workflows to use AI in order to make those recommendations, but still requiring that validation from where we're at right now. And so that's just kind of that balance that I'm always trying to find. And I kind of have been saying this a lot over the last few months. I think the ultimate solution is a blend of both of that, automation and provider, oversight. And ultimately finding that balance is through a little bit of art and science. The science piece is driven by the data analytics that we're here to talk about today. And the art is, I think, just by staying very aligned with the customer and making sure that their voice, in this case, the provider voice, is the loudest voice that we stay true to. And so how can we help them without providing inaccuracy in the workflow as well?
Yeah. Claire, can you talk about how you all are thinking about this balance?
Absolutely. So I'll give an example. We're in the middle of budget right now in terms of building it because we're a 6:30 year end. And so using in terms of the data that we have, we can come up with a mathematically great forecast of where volumes are going to be, but it requires human oversight. Our chief clinical officer may know which physicians are retiring, who's coming back from medical leave, what new procedures are going to be introduced, what is a technology change, what is other new things that we're going to be getting into in terms of services that we aren't today. My network, I can provide additional intelligence on competitor actions or payer changes that have to be considered inside that forecast. So the best forecast that's going to come out of this for our budget is this combination of both in coming from the data for predictions and looking at trends, and then also this human element of what are all those other various different changes, whether they're barriers or other barriers or things that we do inside of our system that otherwise aren't going to come out in the numbers.
Yeah. Bob.
Yeah, I think that it really has been covered and well said. I think that just going off of what Claire, indicated in terms of like her mathematical formula, right, that actually kind of predicts volume, right? And so to me, that's like a good straw model, a good straw, kind of a starting point in terms of then providing that to the chief operating officer, chief clinical officer to say, now what do you know that the mathematical model didn't know, right? So that human oversight to just really, kind of verify that again, that we're going to then have an accurate result. I would also say that, I think sometimes when we stand these up, we're kind of like running parallel systems, right? Like the older manual system, the automated system, and just verifying that we're getting similar results where we kind of like feel like we can just turn it on and let it go, right? And so I think that there is that thing that we've been doing for decades, right? And that, you bring up a new payroll system, right? Like you run the old system against a new system for a few cycles to make sure that you're getting similar, I should say similar, same results, right? Kind of thing, because otherwise people aren't going to stand for, being shorted pay, right? So I think that we've been doing that. And I think it's just even more important today as there's more and more of it coming forward.
Yeah.
So
Oh, go ahead.
So sorry, Mary, I was just gonna comment on that one piece. I think that one thing, regardless of, in your guys' space, a little bit more of the financial integrity, or on my end where I'm trying to inspire that clinical integrity, the tolerance for error in both of those spaces is low. And so thus I feel like our human oversight and that validation, like you said, Bob, of even having to validate those two systems is very high in the areas that we're in, just because that the risk and the error tolerance is much lower in healthcare, I feel like, than other industries.
Sure. Yeah. Um, I was curious to know if there was any misconceptions about AI in finance that maybe your organization, you've heard people say within your organization or even outside of your organization that you found not to be true. Claire, any thoughts on that?
Couple. So we've talked about the first one, which is that AI can't completely replace people. The best outcome is this combination between data and people. And then we also talked about data because AI is considered to be 100% accurate and objective. But if the data is not good, then that can bleed in, and as well as biases. I think the other one is in terms of on a prediction that AI can solve everything and prevent all financial losses. It can't predict everything. Let's go back to the pandemic. It introduced us that what we knew meant nothing. And so as CFOs, we're going through the pandemic, we were having to determine things, and same thing on the clinical side, on a day-to-day basis in terms of new strategies, new things we were going to have to learn, new things we're going to have to put together. And so the historical data and everything that was out there, if it had been available during that time, wouldn't have been so helpful. We have to still deal with people and talking to people and collaborating with people and being able to put that together again with the data together.
So it's not going to fix everything. That's what you're saying.
Unfortunately not. And things happen. We have to adjust.
Bob, anything you wanted to add with that?
Yeah, and I feel like it's just going to be redundant to what, Claire said, but I think that, outside the organization and inside the organization, I think this real sense that, that artificial intelligence replaces people. It eliminates jobs. And I guess, what I would say is what I've seen in our organization is it's eliminating some of those repetitive tasks that people don't necessarily like to do. I think that, we have then upskilled people that were doing some of those repetitive tasks. They now have a better quality of work life, dare I say. And so again, I would say that as we have implemented AI and automation, I would say it has not eliminated jobs. We have as many, if not more, employees employed by our organization today than we did before those things were implemented. So again, I think that that's the biggest fear inside healthcare, and I believe outside of healthcare, is just that it replaces people. And it may, have some impact down the road, but right now I feel like it's just really being additive to do some of that work that again isn't necessarily, top functioning work for people.
Yeah. Kind of in line with that, have there been any challenges you've faced when implementing AI and automation, and how have you addressed them? Claire.
I'll go back to the reason for the Epic refuel, and in particular for our revenue cycle. Our system was set up so special. It had over time since we had originally installed it been made even more special. And because of this specialness, there are things that couldn't be implemented, or it was giving information in terms of, as I mentioned, of comparisons that weren't accurate. And so by going back to this foundation, we have to be standard in our setup in Epic. And so get away from this specialness. So then that way it's easier for us to install tools, implement tools, and rely on the data that's provided, and to be able to get like for like comparisons from, in this case, other Epic facilities that we can compare against and say, oh yes, this tool, and this is where we lie. This is something that we can rely upon, because otherwise it's just not going to be accurate.
Okay. Bob?
No, I think I was thinking back when Maria, about this one, and I would just share, with you that, so several years ago, I feel like there was a vendor that was out there, and we knew other organizations that had implemented their product that actually was supposed to be delivering notice of admission and doing some work to simplify the prior authorization, process. And what I would say is maybe a challenge, and maybe what I would say to you as a lesson learned is that we went for several months with the vendor trying to install, changing the scope, taking some payers out of scope, et cetera, et cetera. And at the end of the day, it didn't provide the ROI that we had talked about. It didn't make us more efficient. And so what I would say to you is that we learned a lesson about contracting, right? As we're contracting for AI and automation, to make sure that we are ironclad in what our expectations are, key performance indicators. And in the event that it doesn't deliver the ROI, there's some opportunity for clawback of fees that have been paid because they haven't delivered what we believe we were buying. So again, I think that's been an important lesson for us, and I've shared it with others as well, and they've thanked me for that because again, I think that we're in early stages of some of these products, and I think that again, they think that they have it figured out, but I don't think they got it completely figured out yet.
Yeah. Megan.
Yeah, I can just kind of, where my perspective comes in on this is whenever health systems have implemented some AI and automated tools, specifically around coding, for example, a lot of, Bob, of what you just said kind of, aligns with the feedback I've heard from them. Is it's difficult to track those KPIs as well over time and see if it really is working, because most customers are not putting in one solution right now to help improve finances or improve rev cycle. They have a multi-pronged approach, and it's really difficult to measure what is actually impacting which areas, both positively and negatively. And they've even brought IMO Health into the table to help them understand a little bit of the effectiveness of their current solutions. So I would say that, it's important as a vendor myself to be able to accurately project the impacts that a customer may see that is, not black and white copy and paste. To Bob's point around the variability of payers, just for example, we can't just take one insight and this is the return that you'll see for this organization based off of somebody who isn't even participating in value-based care, for example. So we have to make sure we really align with that customer's, particular financial mix, and making sure that our solution is accurately projecting what their return will be, and then be allowing them to measure that over time. And if in the event that it's not projecting the ROI that we see, how as a vendor we can pivot and alter that so that they can see that value and do that quickly, not waiting quarters and years to be able to go in and see that difference, really acting in more real time.
Yeah. I'd love to talk about how this has been impacting workflows and teams. So, Claire and Bob, can you talk about how automation has impacted your revenue cycle teams? How has the workflow been impacted? Can we start with Claire?
Yes, so absolutely. So if we talk about in terms of with our workflow, as Bob said, as we applied automation and as we've applied it inside of revenue cycle, we didn't reduce we didn't reduce the number of people, but we changed what they were doing. So we were able
Mhm.
to provide additional training to people. We're able to apply in terms of how they worked within the systems changed, what they were doing changed. The team actually came together in terms of with these tools doing the same thing because you tend to apply something like automation onto things that are more repetitive and it's the same on a time to time. Those things are perfect for automation, things to put those things in place with. So instead, by giving them more interesting work, it makes the job more interesting. It makes the work more interesting and actually makes their efforts more impactful in terms of the returns that you got. So what we've seen is a very happy team in terms of how they work together. Our employee satisfaction scores for our rev cycle team are very high. Very, very proud of that. And our turnover also has been very low. So and that's a big deal in terms of holding on to people after you've trained them on your system. And so having those things in place has actually improved how they work on a day to day, how they work with each other, and then as well, the results and what I'm seeing out of the revenue cycle.
Bob, I saw you vigorously nodding. Has that what you've seen as well with your team?
It is, and I guess I would just say again, I want to applaud, Claire had mentioned early on that, I think they did some things that actually reduced their AR days by 15. That's huge. And
Huge.
that's a huge boost, right, to the team that actually made that occur, right? And I'm sure that as she's mentioning some of these things that they've done with their Epic Refuel and some of these other tools that they're actually using, I think that's probably allowed that team to really feel good about how they could contribute to that actual improvement for the organization. So again, I just was nodding my head because again, it's so heartening to know, again that like using those tools and how the staff really embraces that and actually it's joyful for them. So that's great to hear.
Yeah. So I want to talk about ROI, which we've kind of been talking about. So how are you measuring the return on investment for AI and automation tools in finance? Claire?
Well, I think I'll start off. If it's a small change, we're not going to go through, I mean, if it's a small cost, a small change, we're not going to go through a big formal ROI exercise. We're talking about those for material investments, right? Something that is big. So you get into, in terms of on the cost side, what are the initial costs, such as licensing, infrastructure changes inside of IT or training. You go into the ongoing costs, maintenance, licensure, those type of things. And then you get into the benefits. And so cost in terms of, is it a reduction in cost or improvement inside of reimbursement, such as reduced denials, a reduction in cost. It could come from labor. It could come from, in terms of in supply chain, from reductions in waste. And then, or we can have better cash, I think is a harder one to crude inside of a traditional ROI exercise, because if it's getting me the cash sooner, and let's go back to improvements in days in AR and improvements in cash flow, it's not often seen in terms of that typical cost and benefit as you're calculating the ROI, but it's important to me. I want to have the cash in sooner. I want to have it quicker. It helps me in terms of all of my metrics. And so that's something you have to almost look to the side in terms of on that ROI because it's so important on it. But as CFOs, we're always going to want that cash today instead of tomorrow. And so being able to have that has to be part of that process.
So looking ahead, how do you see data analytics evolving in healthcare finance over the next 5 years? Let's start with you, Megan.
Sure. I think that one thing is going to be speed. I think we need to be faster. I think we need more real-time insights. I don't want to be so reactionary and just really put these data insights in the hands of health systems that they can make more proactive changes in their organizations, in their workflow, so that they can reduce any sort of administrative burden caused by inaccurate coding, inaccurate data capture. And also then, like we've talked about, reallocate resource time towards higher value work. And I would like to do that, like I said, in more real time. So that's where I kind of see that evolving, is having more access to that. For example, we also just launched a solution where we connected providers and payers, where we're going to be delivering payer insights more into the provider workflow, yet again in real time, kind of trying to cut down on that reaction or that time period that goes from the payer having an insight on a gap, getting that back into the provider workflow in a time when they could actually make an intervention where it actually has a positive impact on the patient outcome, where then it actually gets paid for in the timely manner, to Claire's point, and there isn't that delay there. So kind of helping aid that whole workflow, I think, is just speed to insight. So that's, I think, where things are going to be focused in the next 5 years.
So, Bob, looking ahead, how do you see data analytics evolving in healthcare finance over the next 5 years?
Yeah, and I think again, just kind of dovetailing off of what Megan said, again, as somebody who's worked in the industry for more than a couple decades, right? What we've seen really occur in the last 5 years has really been monumental in terms of change, right? Again, all organizations are on EMRs now. It's feeding data warehouses. I think the tools are being built, the automation's actually occurring, et cetera. And so I think that it's really been impactful. I think that it'll be just like what we saw when cell phones came out, right? Like once you start down that road, the impact and the discovery just is multiples, right? So I think that we're going to see significant improvement, right, in the next 5 years. And so again, I would just want to maybe jump in here too. I think that people that we work with, our stakeholders, their financial acumen, because of our ability to tell stories easier. It's easier for us to tell stories with more information than we had before. They now understand the why. Oftentimes we say when you do something, they say why. And now I feel like we're able to answer that question why with the analytics and data that we actually have. It makes our jobs easier.
Yeah, I love that. Telling a story with data. Claire, anything else to add?
I'm excited about the future. I do think it's going to be transformative. I know there's a lot of hype right now with AI, but I think a lot of it is due. I think that we should get excited about the things that it can do. I look to the future, and I think that part of this we can't predict, but I look, for example, on ordering of supplies, for example, that based on the schedule that is there for the OR, that it can be ordered automatically in real time, knowing exactly what this physician needs and being able to have it there so that we don't have to carry so much in terms of on our shelves, and we don't have so much waste in terms of things that are going to be done. And I love what Megan said about real time, because we need to have more information in terms of real time, either it's at CFOs or inside of revenue cycle or inside of my finance team, so that we're able to make better decisions and being able to have it more at our fingertips. On the care side, I think AI is, again, it's a tool for the physicians, and to be able to help make their life better, and be able to make them be able to be more impactful. And I think that the other thing is for the patients, and whether it's on the care side or being able to get more personalized information. I'll think about from a finance perspective, to be able for that price transparency to be a lot more specific in terms of what it's going to be for them, considering their specific health and their history of their health, on those estimates of what their out of pocket is going to be. And then dealing with them on a collection side specific to their situation, and then how we're communicating with the patients, whether it's financial or whether it's clinical, so that it's better for them in terms of for their compliance, and in terms of for me in terms of payment, but it's easier for them. So I look at that personalization in terms of with the patients, that I think that there's going to be a much better experience for them. So I'm very excited about the future with AI and what it can do.
Yeah, and I think patients are really hungry for that level of personalization. So just to close out, any final advice you'd give to healthcare organizations who are just kind of beginning their journey in using data for financial growth? Megan?
Well, of course, mine's going to be to invest in data quality. That's the foundation of everything from the start to the finish of the journey of from the second the patient comes in till the secondary of the usage data to treat the next patient better. So that's really, where my advice would come in.
Bob?
Yeah, mine would just be to continue to leverage data to improve the operations, right? And the operations is the clinical operations, the rev cycle operations, the finance operations, et cetera, right? Like I think that it's really hard to argue with the fact that data behind you is absolutely a strong foundation for you to actually be moving forward with change.
And Claire?
I'm going to go with culture. I think that you've got to make sure that there is this acceptance and willingness towards innovation and towards change, that you've got the right leaders in place who want to try, who want to look into, who are curious, who are looking for not just the way it's always been. It is what can it be and what is possible and what is current and what is modern. And so it is creating that culture inside of your departments, creating it inside of your facility and inside of your organization of not, this is just not how it's always been, but what can it be? And having the right people by your side who are invested and want to bring that and make that a reality. So having that culture of acceptance and excitement about innovation, I think will make a huge difference for an organization.
Well, I think this is a really great note to end on. Thank you. Thank you so much to our panelists for taking the time to offer their perspective and insights on this really important topic. And thanks to our audience for tuning in. Please stick around for the next session.